Now let's talk about the controlled mandatory ventilation or CMV mode. CMV mode is applied to the patient who has very weak breathing effort, the patient who cannot breathe by themselves, like in the case of the poor respiratory drive, severe lung injury, or in the patient who are in deep comatose state. CMV mode takes control of whole breathing. All the breath are provided by the ventilator in CMV mode. There is no effort of the patient in breathing. The patient is sedated, paralyzed, and the ventilator takes control of the patient breathing. We can set a constant volume, constant rate. Pressure is to be decided by the ventilator, as we have discussed earlier. Ventilator control everything. Patient cannot trigger breathing. Now let's talk about the drawback of CMV mode. Since we have paralyzed and sedated the patient has no breathing effort, and if the patient has prolonged ventilated and prolonged ICU stay, there is atrophy of respiratory muscles, and if we set the constant volume and sometimes to give the certain amount of volume, the ventilator has to apply the more pressure, which result to damage of the alveoli and bursting of the alveoli, leading to the barotrauma. And the most dangerous drawback is accidental disconnections leading to death. Sometimes ET tube is disconnected from the ventilator tubing and ventilator control to breathing is lost. The patient is sedated and paralyzed. The patient may die due to the accidental disconnection. Now let's talk about assist control mode or